So in this segment, I'd like to talk to you about regenerative medicine of the thoracic spine. The thoracic spine is the largest part of our spine. As you know, there are 12 bones in your thoracic spine, and most people have 12 ribs. The interesting thing about the thoracic spine is that while it may be the most technically stable portion of the spine, because you have your ribs and it's the part of your spine that moves the least, when the thoracic spine gets hurt, it's one of the more difficult areas to treat, at least according to conventional medicine. Because one problem with the thoracic spine is it never stops moving. Unless you figured out a way not to breathe, every time you take a breath, you're opening up your thoracic spine and it's closing back in. That's particularly a problem with people who've had injury to their ribs. Skiing accident, football tackle, someone stepped on your back, because you not only have the normal attachment of the thoracic spine, you have where those ribs articulate or attach to the back, and those ribs have to have a certain degree of movement in them. So when you have people who have the ligaments that hold the back of the ribs to the back of the thoracic spine have gotten damaged, we have an issue, because you can't not breathe. And every time, I have some people who've told me, every time I take a deep breath, I have pain, like a shooting pain in my back. So the purpose of regenerative medicine, again, is to stabilize these areas. In the thoracic spine, we're focusing on, at least in the back of the thoracic spine, two major areas. One are the facet joints, and if you've watched any segments, previous segments about the cervical spine or the lumbar spine, you know facet joints are what help provide stability by keeping the vertebra or the bone above and the vertebra below attached almost. It's a piece of bone above and below that kind of, almost like two dinner plates, touch each other. What you're trying to do is irritate and stimulate the ligaments around those facet joints, the facet ligaments, to strengthen up and provide stability so you don't get too much slippage and they're moving together. But what's very important also in the thoracic spine is to look at what's called the costovertebral junction, which is a 10-cent word for the attachment of the ribs on the back of the spine. Because often when you get pain there, that's a condition that's extremely hard to treat, and some people live with it for a lifetime. If you can strengthen up those attachment points, you start to get a very strong rib that moves only as far as it's supposed to and doesn't get all that extra motion that causes pain. The thoracic spine tends to take a little while. Again, it's a big part of our back. It's a lot of little injections, but generally people tend to tolerate it very well. A common question people will ask you is, well, how do you not puncture a lung? So that's a really good question to ask. Couple little tricks. Number one is you know your anatomy. Number two, you know where to poke and not to poke. And number three, when you do certain structures, what you'll often do is have someone breathe out and just hold that for a second or two, make the lungs as small as possible, and then hit that area. Then once you've moved the needle, then you can have them breathe in. Knock on wood, this is extremely rare occurrence, but sure, it's something to be aware of. And the last thing about the thoracic spine or the middle back is that sometimes it's not the spine at all. Sometimes it's the attachment of the muscles of your scapula or your shoulder blades. Weightlifters, swimmers get this a lot. Guys who do a lot of pull-ups. Sometimes the attachment points of those muscles along your shoulder blades get a little wear and tear in them, and people get a lot of pain in their shoulders droop forward. Well, you can attack those with prolotherapy or PRP or stem cell injections, or even placental graft matrix sometimes. And by hitting those things, you can stabilize those muscles of your back and get the normal, upright military kind of posture you're supposed to get.